Okay, so let's welcome our next speaker, Mark A. Favors. Born and raised in Colorado Springs, Colorado, Mark A. Favors is a U.S. Army veteran. Thank you, Mark. And a registered nurse, and currently residing in New York City. After leaving the Air Force via Peterson Air Force Base, it was admitted that Peterson Air Force Base actually dumped toxic PFAS chemicals into Fountain Creek for decades, and that more than 15 members of Mark's family who resided in these El Paso counties and drank this PFAS contaminated water had been diagnosed with cancer. And for that reason, Mark has taken on an ardent advocacy role. He's testified before the U.S. House Oversight Committee in Congress, and he's currently a member of the Fountain Valley Clean Water Coalition, advocating for safe drinking water and justice for Colorado. Welcome, Mark.
Thank you, and thanks for inviting me to speak. One thing that I would like to say, first of all, is when you talk about the legislation which Liz has passed, which has been great, the Department of Defense are exempt for most of the state legislation. So that's one issue, is that we've passed great legislation, but the Department of Defense is exempt. And we're one of the unique places in where the Peterson Air Force Base, United States Air Force, actually admitted dumping AFFF into our drinking water source 3 times a year from 1991. They think the contamination actually started in 1970, but they started doing the dumping in 1991. And one thing I think is important for this committee is that in Colorado Springs, we have 5 military bases. So the Army base, Fort Carson, which is also in El Paso County, in 1990, the Army Corps of Engineers told them they needed to replace their PFAS-laden foam with something non-toxic. Meanwhile, a 10-minute drive away, Peterson Air Force Base thought it was good to dump it into our drinking water source for the next 15 or 16 years. So that's another reason why we need consistency and clarity. And also, our PFAS, the blood levels have been 10 to 20 times higher, the PFHX, which the CDC has found, University of Colorado. And this is 2 to 3 years after they started filtering PFAS out of the drinking water. So when you take, for example, my family, in which numerous people had cancer, but I'll focus on the ones that had kidney cancer, because the U.S. courts have already linked PFOA as causing kidney cancer. So if you see the movie Dark Waters, it illustrates that. But where I think the transparency is needed, because number one, I had a 14-year-old cousin 3 years ago who had to have a kidney transplant. The doctors ruled out that it couldn't be caused genetically. His mother had lived in the contamination area since she was 10 years old. And then all of a sudden, out of the blue, he had to have a kidney transplant. And of the 5 people on both sides of my family who have had kidney disease, no one who's lived outside of the contamination area has ever had kidney cancer or kidney failure. And so what I think is important medically, and what Liz also talks about is, I had to have, 2 cousins on my mother's side had to have kidney transplants. And one of my cousins, her brother, these were my first cousins, he gave one of his kidneys to her. And then they, a few years later after that, they said, oh, that kidney has cancer and it had to be removed. Meanwhile, my father, and obviously he's not any blood relation to my maternal cousin, he moved into the area, into my grandmother's house after she had died of cancer, and his kidney failed. He had to get a kidney transplant in Denver, like my other cousins, because they don't do kidney transplants in Colorado Springs, like Liz alluded to. All of a sudden, my father got a kidney transplant. 2 years later, they had to remove that kidney because they said it was cancerous and failed. So we just thought, that's God's will, bad fate. Then it was later in 2016 where the Air Force admitted that they had dumped PFAS into the drinking water. And if you know the EPA's recommendations of no more than 70 parts per trillion, according to the Department of Defense, in some drinking water, they found 8,000 parts per trillion, which is why if you see the CDC, we had the highest PFHX blood levels in the entire country, with the exception of people who actually manufactured the chemical. And so, and this went on since 1990. So a lot of my cousins, while they were fighting in Iraq and Afghanistan, their children were drinking this contaminated water. I have 5 members who are buried in includes my stepfather, who are buried at Fort Logan National Cemetery, after surviving combat tours in Vietnam, Korean War, and Afghanistan. They're now buried in the National Cemetery from cancer after, the military has said, oh, they dumped this toxic chemical into their water. And so another thing I would like to mention as far as the medical thing, where Liz talks about people moving. So, I didn't find out about this till 2018 later when I was visiting my mother from New York City, and she showed me the story on TV. So another one of my cousins who now has her children are 23 and 24, back in the 90s, she lived in the contaminated area while she was stationed at Fort Carson. So, and she's still in the United States Army active duty. So when I reached out to her and told her about this, she was like, oh, that's funny, because her youngest daughter, they didn't know why, they found tumors on her liver, because that they could not explain. And that's why we need to keep all this information open and transparent. Right now, now that COVID's over, during COVID, I was working in the ICU, but now I'm back to working in endoscopy GI. And that same study that linked, the largest public health study that linked kidney cancer to PFAS, it also linked irritable bowel disease. And all the gastroenterologists that I work with, they had never heard of PFAS. So I had to do an education on them. And then one time when I was in Congress testifying, I ran into a bunch of oncologists who were there lobbying, and they were like, what's PFAS? And so, we need to put the word out there. We need to have transparency, and we need to, because if you look at the other study too, they did 38 children. So when you look at my 14-year-old cousin had to get a kidney transplant in this latest study by the CDC, what does that mean for the 28 children who they did blood levels? Is their blood levels elevated? Can their parents expect that they'll have to be looking at a kidney transplant in the future? And, when my cousin, when she was a single mother at the time. So all of a sudden, when they told her son's kidneys failed, she had to get family together. She had to figure out how to get a kidney, all while going back and forth to Denver, because Denver's an hour away and they don't do transplants in Colorado Springs. So, and it's a shell shock. So it's good to have this medical information, that's there and that can be shared. And also the state of Colorado, even though they had a $1 billion budget surplus back then in 2018, because everybody knows Colorado has recreational marijuana, they never have provided any testing. So, because the military is, it's a large presence. I was in the military, all my family is there. So they have a large economic footprint. So meanwhile, here in New York, in Newburgh, the state tested everybody, but there in Colorado Springs, there was no testing by the state. So people had no idea how to get any of their blood levels, how to get any of this medical information. So I think we need to have consistency and transparency, especially when not only in just Colorado, but also in New Hampshire, when they pass state limits for PFAS, the Air Force has already told them they will not comply. They've cried sovereign immunity in Colorado, Michigan, and many states. So that's why we need to have this information out there for people, that get out of the military, people that move around, and we just need to have some consistency that can be adhered to. So if these people aren't going to comply with the state regulations, this is important that we get this medical information out to people. And I'll end there.